Hello and welcome to the EDU-TALK Series hosted by Biotone EduPartner Program, and massage industry experts. With the continued interest and popularity of the EDU-TALK Series, Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Tonight's expert is Kerry D'Ambrogio, President and Director of D'Ambrogio Institute. And he's an International Alliance of Healthcare Educated Certified Instructor. Kerry began lecturing in 1988 and is author of numerous industry articles, as well as author of the textbook, Positional Release Therapy. Additionally, Kerry is a doctor of Oriental medicine, a physical therapist, an osteopath, and a past presenter of EDU-TALKs with 4 EDU-TALKs in the archive library on biotone.com under the EDU-TALK tab. Let's listen, learn, and dive into the world of energy, medicine, and quantum physics with Kerry's introduction to energetic balancing. He'll reveal the essential principles of energetic balancing, energetic anatomy, and the development of energetic balancing techniques. We'll engage with Kerry in a guided self-evaluation and experience firsthand a self-energetic balance treatment, plus observe the transformative effects through a final evaluation. Again, thank you for having your videos off and your sound muted. And please feel free to chat questions and comments to Kerry, which I'll answer at the end. And with that, again, welcome everyone. Kerry, it's all yours. I'm going to exit the screen. I'll see you on the other side for chats.
All right, that was well done. Thank you. So this is number 5. So we are going to be talking about energetic balancing. And have you spotlighted me, Danelle? Do I see you there? Just make sure you've spotlighted me.
No, I didn't spotlight, but you have the full screen, Kerry.
Okay, not on mine. Okay, let me see here. Yeah, all right. So, you know, when I think about it, I've been doing this work since 1988, and I'm going to share with you my background. And this would be the last subject, if you were to ask me years ago, that I'd be talking about, talking about energy. I'm, as Danelle said, I am a, doctor of Oriental medicine, so I do acupuncture. But I'm an osteopath at heart. I'm a physical therapist. I'm a manual therapist. I love using my hands like a lot of you do. And tonight I'm going to show you something a little bit different. Some of you may have experience of this. Some of you might not. But we'll show you something different. We're going to kind of end the night with a little bit of self-discovery and a little bit of work on yourself. And I'm going to share with you some case studies. I'm going to share with you kind of my journey in a sense with this and how it's unfolded for me and how it's made a big difference in my life. So let me share my screen. There we go. Does everybody see that okay? Gives a thumbs up. Now, when we take a look at energy balancing, I put together a couple of different sections I thought would be interesting for you. I'm going to talk a little bit about clinical decision making. And the reason why is that we all have to be able to make a clinical decision on when to use this type of work. Okay? We're going to talk about what is energy balancing. We'll talk about, why learn it, of course. I'll get into some case history. I'll get into the history of how I developed this, and it just kind of unfolded with sort of what I was doing. You're going to get to experience in energetic balancing, and then I'll share with you some courses that I'm doing, some things that I'm doing right after that. So let's begin. So as practitioners, we're all faced with the same three questions. And we're faced with these questions every time somebody walks into our clinic. So here we have two patients here. They both have knee problems. And if you ask them, they want you to do something with their knee. They want you, and the doctor may want you to look at it. Okay. The insurance company may want you to look at their knee. But definitely everybody wants that. And the question that we have as practitioners is, where do I treat? Okay, where do I treat? Now, you should ask yourself this question as well. If you have two patients that are coming in, where would you treat? Let me go to the vibe board. So here at the vibe board, let's say we have a knee problem here. The question that we need to ask is, how does a knee heal? Well, it needs blood supply. So it needs blood supply from the heart carrying oxygen nutrition. But in order for it to receive that, it has to get rid of the waste products. And it does that through the venous return. And it also does that through lymphatic return. So we call that the pathway. Okay, so that's called the pathway. So we have two choices here. We can either treat locally at the site of the problem. So this would be called specific, right? Or we can treat along the pathway, okay? And some people call that systemic, okay? So we have those two choices. So when we take a look at that, where do we treat? We're going to have to make a decision. And we teach that in our classes. We teach a total body screening examination that helps you decide whether you're going to treat locally or whether you're going to treat more systemically. And it takes about 4 or 5 minutes to do. But the beautiful thing is that when you take energetic balancing, you can ask the body. We teach you a biofeedback test. So if somebody comes in with a knee problem, you can actually ask, is this a local problem, a specific problem, or is this more systemic? The second question we all face as practitioners is, what do I treat? Okay, so if we go back to that whiteboard and we look at the knee itself, what are things that we could possibly treat in the knee? We can treat superficial and deep fascia. We could treat muscles, bone, joints. We could treat fluid, lymphatics. We could also treat the pathway. So what would that look like? So let's go back to the whiteboard. So when we go back to the whiteboard, we can look at transverse diaphragms. So the pelvic floor, the respiratory, and the thoracic inlet. These transverse diaphragms can create a barrier to the movement of those vital structures, the arteries, the veins, and the lymphatics. If we look at the wall of any of these vessels, there's 3 layers to it. There's endothelial, there's smooth muscle, and then there's connective tissue. So when we look at the smooth muscle right in here, this is basically under the control of the autonomic nervous system, right? The parasympathetic, that's cranial nerve 10. And then we have S2, 3, and 4, but also here the sympathetic. So we have T1 to L2. So we can treat the autonomic nervous system. The final thing that we could look at is we could look at lines of fascial tension from old injuries that somebody may have. So when we look at the body more systemically, right, these are things that we can pay attention to, either looking at more specific or more systemic. So if we go back to our PowerPoint here, we have to understand that all of these things that I'm talking about are made up of energy. So it doesn't matter whether we're going to be working specifically or more systemically. The fascia, the muscles, the bones, the joints, organs, any of those things I'm going to show you tonight are all made up of energy. And so as practitioners, we have to decide at what level do we need to treat at. Okay? So the third question we all face as practitioners is, once I know where I'm going to treat and once I know what I'm going to treat, do I have the necessary tools to do the treatment? That's the key thing. And so that's why I developed the D'Ambrogio Institute. I developed this institute because I wanted to teach other practitioners. These are things that I had difficulty with. A lot of the classes I took, we kept learning a lot of technique after technique after technique, but nobody ever taught us evaluation to determine where we treat, what we treat, and also making sure that we're treating the right way. So that's what our focus is. Okay? So what is energetic balancing? So energetic balancing is a manual therapy technique, but I would call it a energetic manual therapy technique. It's where we balance. This is a term that I created, the human biomatrix, and you'll see why. Some people call it the energetic blueprint of the body. You could also call it an energetic hologram of the body. So you see the picture, of the person with the hand, that's what it kind of looks like. Is you can work on, and we teach you that in the classes, working on a hologram of a muscle, a bone, a joint, an organ, a blood vessel, a nerve, anything. And also an emotion, a belief system, and consciousness. So to understand this biomatrix, you take a look at this model. If you look at the page numbers, page 4 to 8, I gave you a handout. You should have that, and you can come back and look at this again. But on those pages, it's going to describe what I'm going to talk about right now. So the human biomatrix, that's you and your totality. And I want to go over sort of what you're made of, in a sense. You actually, when we finish this lecture, it all comes down to you're actually made of 3 things. So the first thing that we're all familiar with is the biological structure. You, as this human biomatrix, you are made up of different systems, okay? Yeah. You are made up of different systems, the musculoskeletal system, which you're familiar with, the integumentary system, urinary, digestive system, all these different systems. These systems are made up of different organs. Organs are made up of tissues. We only have 4 types of tissues in the body. We have endothelial tissue, that's the tissue that makes up your skin. We have the endothelium that makes up the lining of your blood vessels and your cavities. We have muscle tissue. We have 3 types, cardiac, smooth, and skeletal. We have nerve tissue, and we have connective tissue. Connective tissue is a wide grouping. It can be the fascia, it can be ligaments, capsules, it can be tendons, it can be blood, bone, all sorts of different things as connective tissue. All those tissues are made up of cells. So bone cells, muscle cells, nerve cells are all different. Those cells are made up of organelles, a nucleus, mitochondria, and that all makes up biological structure. You, as a massage therapist, specifically works with the tissue. You work at the tissue level, right? A lot of you work at the muscle level, the connective tissue level, some of you the endothelial, but you work at that level, okay? So we're going to go to the next level. The next level is chemical structure. So those organelles are made up of biomolecules. What are biomolecules? Fats, proteins, carbohydrates, right? Vitamins, minerals. Those are made up of molecules. Molecules are made up of the elements from the periodic table, and they're made up of atoms. And that's when we start to get into quantum structures, okay? So when we look at an atom, you're going to see that it has a nucleus, it has an electron field around it. That nucleus is not fundamental because if you zoom in on it, it's made up of protons and neutrons. They're not fundamental either. Protons and neutrons are made up of up quarks and down quarks. So we'll go a little bit closer and zoom in on that quantum structure. So here you can see, you know, the atom, the nucleus, the electron field around it, okay? Now, electrons, which buzz around it, those are fundamental. Fundamental means it's the smallest unit of energy or particle. Also, when you look at the nucleus, it's made up of protons and neutrons. Protons and neutrons are not fundamental. The quarks are. And so they're made up of both up quarks and down quarks, and they're connected by this little squiggly line, and that's called a gluon, okay? So you could say that your body, the human body, we all know from, you know, the periodic table that it's made up of primarily oxygen, 65%, carbon, 19%, hydrogen, 10%, nitrogen, 3%, and then 3%, you know, other things. But if we go down to what it's really made up of, it's made up of electrons, up quarks, and down quarks. And that's the same for everything in this planet, everything in this universe. So the cell phone you're on, the computer you're on, the chair you're sitting on are made of those three things. Piece of wood, you know, the walls, everything, right? Your treatment table, it's all made of those same things. Okay? So let's put it all together for you. Your body is made up of over 30 trillion cells. These are the cells that make up your skin, right? Your muscles, your bones, your joints, your organs, your brain, right? Your spinal cord, nerves, arteries, veins. Each of those cells are made up of 100 trillion atoms. And we just said the human body is made of oxygen, carbon, nitrogen, hydrogen, okay? So all those different structures. Each atom, when you look at it, it's made up of, it's basically 99.9999999% empty space. So how can that be? So this is just a general picture of it, but an atom has a nucleus, but it's so small. And let's look at a carbon atom, for example. So a carbon atom has a nucleus that has 6 protons, 6 neutrons. If we were give them a size, let's say a pearl from a pearl necklace, and if we were to place it in the center of a football field, right, that carbon atom also has 6 electrons, which would fill that football stadium. So that's why they say it's 99.99999% empty space, because it is, but it's not really empty. It's energy. It's energy vibrating. So when you think of it, your body is over 30 trillion cells. Each cell has 100 trillion atoms. Each atom is 99.9999999% empty space. But it's not empty, it's energy. So your body, by definition, is made up of energy. So if you're made up of energy, and that wall is made up of energy, and your chair is made up of energy, why don't you just fall through? It's because you have to understand that the outer layer of the electron is negative, and it is chemically bonding with other, you know, electrons. And so negative upon negative sort of repulses each other. Okay? So that's why you don't fall through your chair or can go through a wall, because of that negative reaction. All right, so let's continue here. So since the human organism is composed of these fundamental particles, right? So we know that. And these fundamental particles we now know are units of energy. You can say that the human body is also made of these dynamic unit of energy. So you are made up of energy, and that's quantum physics. This means that all biological matter, it means your skin, your muscles, your bones, your fascia, your fluids, everything, right? And also you could say psychological processes, your thoughts, your emotions, right? Your beliefs, your consciousness, all of this is composed of energy, okay? So why learn energetic balancing? You know, that's kind of cool, but, you know, how does it apply to you as a massage therapist? This is my grandson. He was actually here today. It was my wife's birthday, and he surprised us. He came in, he's 1 year old. But this was him on his birthday, his first birthday. When he was born, he wasn't breathing, and his heart wasn't beating. They had to do CPR, and they had to intubate him right away. And he was over in St. Pete's Sick Kids Hospital, and they would reduce his body temperature to, I think it was 92 degrees. so he wouldn't get brain damage. It was so scary. And this was my son Blake and his wife Sarah's first baby. And I remember I told him, I says, your baby knows who you are. You need to go there and touch him as much as you can and talk to him. And it was amazing. I was there when he was touching him, and he would talk to him, and right away, his name's Hudson, would turn to see his father because he remembers, he could hear it when he was in the womb. So because of this energetic balancing, when you learn this technique, you can do it on yourself. You can do it on family members, and your patients and that, but you could also do it over Zoom. You can do it remotely. When COVID was on and things shut down, my business flourished because a lot of my patients were afraid to come in, and I just started treating them on Zoom. And it works extremely well. And we teach you how to do that. So here's a picture of me working with the little guy. And this was all, his first week. But take a look at the difference in this picture. Look at him. You can see the red complexion. You can see that he's in a bit of a crisis mode. But look at him after 5 days of treatment. Just look how comfortable he is, how at peace he is. And this was his picture on the last day. It was just beautiful. And he's such a beautiful little boy. It wasn't just me either. What I believe, and you're going to see a little bit later, is I believe in universal consciousness. Because I teach internationally, when this happened, I reached out to everybody I know. Some of you may be on here tonight or even watching this, so thank you. I reached out to everybody, and so much love came in. So many people did distance sessions, just sent love, or did what they could, Reiki or this type of work, because I had people in Japan and China, Poland, all sorts of different people were helping out, and I really thank everybody, because his when I taught in Japan and Tokyo, I was sharing this, and there's a couple of nurses in the audience, and they're work with kids, and they were saying that's an amazing story, because each day he responded so quickly. And a lot of this picture was on the last day, but the other pictures that like after 3 days, and they go, you don't get that kind of results. So this is such a beautiful treatment. Here's something else. These are two patients of mine, both coming with neck problems and headaches. And the guy on the left is an accountant. The woman on the right, she's from Montreal. And the guy on the left, he's 6'4", he's an accountant. His was pretty easy to determine. It was more local. Remember I said the clinical decision making. One of the things that energy balancing teaches you in the biofeedback test is right away you need to determine, is this a local, a specific problem, or is it more systemic? You can do that with the total body screening examination that we teach you, but you can do it a lot quicker just dialoguing with the body. Just once you understand that, you ask, the person has a neck problem. Oh, do I focus specifically? Do I focus local? Or do I take more of a systemic approach? His was more specific. We just had to release his levator scapula, release the vertebrae. She was much different. She had a car accident. Her left foot was filleted. She had like 4 operations. When I met her, I met her 10 years after the fact. She had seen chiropractors, physical therapists, massage, acupuncturists. Everybody focused on her neck. And I drew a circle around it because she had a line of fascial tension from that foot coming all the way up to her neck. Okay, because your fascia is all interconnected. The meningeal fascia around the brain and spinal cord is continuous with your visceral fascia, with your deep fascia and your superficial fascia. So picture this. She's lying on the table, legs are straight. I'm standing at the head of the table. I'm trying to move her head around. I can't. As soon as she bends that left knee, it relaxes the fascia there. I can move it around anywhere. But it was the energetic balancing, the biofeedback that led me to that left foot. Why would you work on that? Why would you work on that left foot if someone's complaining of neck pain? So she responds. So you can see here that you can have 2 people, they both have neck problems, but where do you focus on? Either you evaluate for this or you ask the body. And the third last one are 2 people, they're both complaining of shoulder problems. One is more local. Okay? It was a local injury. It's more specific. The other one was not. It was coming from a lower back issue. And she had problems. I think I saw her and she had a problem for like 3 to 4 months. And everybody was treating her shoulder. Had nothing to do with the shoulder. It was a lower back problem. And it was energy balancing, the biofeedback test, that led us to that area. Excuse me. And we were able to, it was the latissimus dorsi, the fasciae, into that thoracolumbar region. We had to work on the vertebrae and work on the energy flow. And she responded extremely well. But there we have two shoulder problems. So you can see that if you can find out exactly where to treat, it's extremely valuable. Okay? So why we learn it is for those patients that fall through the cracks, right? The Hudsons, the people that have failed surgeries, the people that are over medicated, the people that go from doctor to doctor, they go from patient or to therapist to therapist. Okay, these are the people. And sometimes it helps us to work on different levels. It may be not enough to work on the muscles and fascia and fluids, maybe you have to work at a different level. And they could also be holding a belief system or emotion there, okay, that we have to deal with. So what's the history behind it? So this is me back in 1985, I guess. I was number 35. My goals were to play professional football. I had lots of injuries. I had concussions, shoulder injuries, knee injuries, groin, back, and basically the treatment of choice where they would submerge me into ice cold whirlpool tanks. For 10 minutes, I had to stay in there, and they would pull my lifeless body out, and they would ultrasound me, electrical stim me, stretch me, massage me. And I found that these treatments did help. They did get rid of the acute pain, but I still kept complaining of these other areas. And so I knew my days as a football player were numbered. So I ended up becoming an athletic therapist. And I ended up subjecting my patients to the same treatments that I got. So that led me into going to physical therapy school, went to University of Toronto, so I'm from Canada. And I took hundreds of classes. I mean, I took fascial classes, visceral manipulation, cranial, strain counter strain, lymphatic drainage, all sorts of different things. And I remember that after taking all these classes, I was thoroughly confused. I remember being in my office one day, working on a patient with low back pain. I didn't know what to do. I had all these techniques in my head. I didn't have an evaluation. I didn't have a way to determine where to treat and what to treat. And that's why I went back to school, to osteopathic school. In osteopathic school, they care more about the anatomy. They care more about principles and figuring out what you need to do. So I share all this information because if a patient comes to me with, please mute yourself. If a patient comes to me with a right knee problem, how do I make my clinical decisions? Well, I was a football player. I have experience being treated. I know what didn't work. I was an athletic therapist, physical therapist. I did all these manual therapy and osteopathic school. So what do you think my treatment would be? Manual therapy. That's all I knew, how to work with these knees. And then eventually I went to acupuncture school, and that's where I met this guy, John Veltheim. He introduced me to something called Body Talk. And Body Talk is energy medicine. And this is the first time I started to understand about this. And he's saying that there's a way to communicate with the body. And a Body Talk helps to improve communication so that things are working and relaxing much easier. It's very quick. And he's the one that showed me this top-down causation. Take a look at the bottom, physical body. I shared with you my story because that's where most of my life was spent, taking hundreds of classes, being an athletic trainer, physical therapist, all this stuff. But they say it's the bottom of everything. It's the least important. They say your energy body is more important, your emotions, your thoughts, your beliefs, your consciousness. Look at the top, universal consciousness. That's why I had everybody helping me treating Hudson. Okay? So I developed this total body lesion, where we put the physical pain, let's say example would be the knee in the center, but it could be influenced by your thoughts, your beliefs, your emotions, your behavior, your consciousness, as well as environmental factors. So I use that when a patient comes in, for example, with a knee problem. I don't just look at the physical. I look at the total body lesion, including the energy. So I started teaching Body Talk, and Body Talk is very subtle energy medicine. So I started to do lots of evaluations before and after to show it works. And then I taught this orthopedic class. When I was teaching in Germany, There was a woman who was complaining of a job problem and headaches. And I evaluated her and I said, well, you need some cranial work. She goes, I've already had lots of cranial, it's not working. And I said, well, you need a body talker who does it. So he goes, well, you're a body talker and you do it. Can you treat me? I said, all right. So I had to do very specific things, balancing her sphenoid bone to her clavicle, to sternocleidomastoid, to something else. It was very specific, and I was able to help her. And she said, wow, that is really cool. Why don't you develop a class? So I did. It was body talk for fascia release for body talkers, where we would use the body talk systems to talk to the body to find out where we were. And the class went really well. And I was in North Carolina, and there was 3 women in the class. They go, they're energy workers more. And they go, do we really have to do this on the body? And I go, well, that's how we're teaching it, but you don't have to. You can do it off the body. She goes, can you show us? And I go, I think so. Never did it before. And there was a guy in the class, his name was Dr. Lord. He was a chiropractor. And he goes, why don't you treat me? I've got a sore hip. And there was 2 Belgian physical therapists there, and they go, and we'll evaluate, because they know that I like to evaluate. So they evaluate his hip, straight leg raise, rotation, hip flexion. He had very little movement. And I'm thinking, what did I get myself into? So I have a strong background in manual therapy. And so I just looked at his hip, and all of a sudden an image popped in my mind of his greater trochanter, the hip bone. I could see it. So because I'm a manual therapist, I reached in there and I just kind of put hold on it. That's what we call a hologram. And I just started to observe it. And what started to happen was it started to move. And then all of a sudden my hands went like that. And I go, I guess we're done. And we reevaluated, and oh my God, everything was moving much better. It was incredible. I've never seen results like this. It was within like 20 seconds. And I go, that's how you do it. And I go, bullshit, what'd you just do? I go, I have no idea. I knew these people. We were up till midnight that night, and we had 2 more days of this class, and I had to rewrite the whole manual. Next week I was teaching in Toronto, totally different manual. It was just exceptional. I love this quote by John Wooden. It's what you learn after you know everything that counts. And I mean, I wasn't expecting this at all. This was just fell in my lap. So now what I want you to do is I want you to experience this for yourself. The best way that I have found to really understand the energy work is to use your 5 senses, right? Use your sense of visualization. I'm going to take you through it to see, we're all going to pick a spot and work with it, but I'm going to kind of prompt you through visualization, what you feel with your hands. And it's amazing, if you're a manual therapist, even though you're off the body, you can feel it. And then sometimes things will pop in your mind, like thoughts and emotions. And there are tastes. I don't get very many of those, or smell. The other ones are more powerful. So this is what we're going to do. We're going to tune in to our bodies, find an area of tension. We're going to do a little bit of a self-evaluation. We're going to observe this lesion, reevaluate, and then we'll talk about that. So I'm going to head to the front of the room. So you should be able to see me. All right. So here's what I want you to do. I want everybody to stand up and just kind of march on the spot for a second. Good. I want you to close your eyes. And I want you to tune into your body. Tune into your feet, your legs, your pelvis, your torso, your shoulders, your arms, your head. Here's what I feel in my body. I feel a difference. I feel like my left side of my body feels more tense, but I feel like I'm weight bearing. It's really weird. I feel like I'm weight bearing more on the right side. I feel like my right shoulder is lower. I feel like my right side of my pelvis is lower. I feel like I'm weight bearing more on that side, but I see more darkness on this left side. It's really strange. So first thing you do is just evaluate. Now, where is this area of tension? For me, it's right here. It's at the back. So like right in here. And if I was to give it, and you find out where yours is, and give it a number from 0 to 10, I'm going to give mine a 6. Okay. Let's do a couple of movements. So this side, I'm going to check my shoulder. That moves pretty good, but this side is much stiffer. I'm going to try side bending my body to the right. It likes to do that. And when I go to the left, I can feel more of a resistance. I can try rotating to the right, moves nicely. I go to the left, there's more resistance. Okay. I can try, let's see here, flexing. There's tension there. But my body likes to extend. It doesn't like to flex. All right. If I go to my neck, it likes to extend, but doesn't like to flex. Okay. So that's enough evaluation. So what I want you to do now is just take that area, that energy out and place it in front of you. Make sure your arms are comfortable. It's all energy, so just bring it in front of you and close your eyes. Let's start to use our 5 senses. So open your eyes and just see how far apart my hands are. That's how big my energy is. And I want you to feel it. I can feel the boundaries of it. Well, you want to determine through your visualization and your sense of touch, how big is it? Is it like a golf ball, baseball, bowling ball, beach ball? Is it a ball? What shape is it? And then start to feel and see, is it smooth? Mine's smooth. Some of yours could be jagged, could be sharp, could be bumpy, right? And what about colors? Is there a color to it? Mine's kind of a bit of a black color. You may have different colors, okay? Now, the other thing I want you to do with this as you're observing it is be aware, remember, of hearing pop-ups. Is there any emotions that are in this? What's the first thing that comes to your mind? For me, what comes in there is almost a little bit of a sadness. And then see if any words come to mind, like a thought or a belief. And so the thing that pops into my mind is kind of like an overwhelm. So I observe that. So this is your subconscious, your ability to tune into things, because that was already there, but I wasn't paying attention to it. I was too busy getting ready to teach for you guys, treating patients today, doing other things. We don't take the time to access our creative mind. We're in survival mode most of the time. So I want you to breathe in and out. And just let this tension go, breathing in. Just do about 5 breaths. And then let it go. So I'll march on the spot. And right away, I can feel my shoulders are more level, my pelvis is more level, my feet are more level. I can evaluate this arm. That feels much better. This is what I like to do. This is easier. This is why we evaluate. We don't evaluate to diagnose so much, but to show change so we can learn. Flexion is easier. Okay. I can go here. Oh, that's a lot easier going down. So see what it's like for you. I'm going to head back to the main camera. Okay, so this is what we did. We tuned into our body. We found an area of tension. We did a self-evaluation. We observed it with our 5 senses. And it's interesting, it's like our subconscious is telling us something. And just when we take the time out just to access our creative brain, instead of, a lot of us are in survival brain all day. You know, we eat food, but we don't taste it. You know, people say things to us, but we don't hear it. We don't listen to what's happening in our body. Okay. All right. And now if you want to, you would have got this in your package. If you didn't, you can take a picture of this QR code. This takes you, here there's you'll get a 1-page handout that you can give your patients, and there's a video with this. And you can use that. You can give it to as many people as you want, but it goes into what we just did here, but into a little bit more detail. Okay, so I gave that to you that you can play with. The other thing is, these are some opportunities. I'm teaching a introduction to energetic manual therapy this Sunday, actually. It's from 11 a.m. to 5 p.m. It's all online, so it doesn't matter where you are. It will be recorded. And that's an introduction. And the reason why we have that is some people, they're interested, but they don't know if they want to jump in with both feet into taking the energy balancing level 1 class. If you decide to take the introductory class, you can use that money and you can go towards the energy balancing level 1 class. Okay, that's a 6-day class. And in this class, this is where we teach you to work with the energy holograms of fascia, superficial and deep, the meningeal fascia, the muscles, bones, and joints and sutures. So you work with all those different structures. Okay, that's my sister Kelly. That's her email, and you'll be able to contact her if you go to that QR code as well. And I'm doing an energy balancing. I think it's a 4-hour one in Burlington, Ontario, Canada, at the Canadian Massage Conference. So you can take a picture of that if you want. And that's October 3rd to 6th. I think I'm doing it on the weekend. They have me there on the weekend. Okay. All right. Here's my contact information. If you want to follow me or have any questions, that's my email. That's my clinic. I'm in Sarasota, Florida. It's our clinic number. But I have a brand new website, drkerryd.com. It is up, but it's brand new and it's kind of still under construction. So it's not complete, but I do have the old D'Ambrogio Institute there. And you can follow me on Instagram, LinkedIn, and we do actually on YouTube, we do have a lot of energy balancing demonstrations, okay, that you can see. And you can see the before and after in a classroom and actually see other students come up and measure, before and after. Danelle, I can't believe this. This is like exactly on time. 6:45.
You did great.
How about that? Right to the T, huh?
Amazing. I mean, I could keep listening. And thank you so much. And thank you, everyone. And again, I'd like to mention that tomorrow you'll receive a follow-up email, and it will include Kerry's contact information, recording link, and the handouts. And there'll be 3 handouts. And Kerry, you kind of beat me to the punch on what do you have coming up. So we're ahead of the game all the way around. I really appreciate it. Everyone, I haven't seen any chats or comments come in. We still have a few minutes for you to ask Kerry questions while we have him here. And Kerry, did you say you'd be walking around AMTA in Tampa?
Yes. Yeah.
Okay,
I'm actually gonna be there on Thursday, probably at noon. And I'm probably going to be at the Upledger booth, the Upledger and Burrell booth. Those are my people there. I did a lot of teaching for them. So I'll probably hang out there. So if anyone has any questions, they want to chat or whatever, that's where I'll probably be in the afternoon. I'm going to visit some old friends. And I think I'm going to be seeing another lecture for you, James Wozlotsky, that night. We're going to go to dinner with a few other people. So we'll have a lot of fun. I taught at that. Actually, we were both there last year in Phoenix.
Right.
In Arizona.
Right.
And they don't allow you to teach 2 years in a row. So I'm not there this year. So hopefully I'll be there the next year.
Okay, well, keep an eye out for Kerry. Upledger typically has a booth right at the front. And everyone knows what he looks like, so you'll be able to track him down. Just, my little question was, as we were doing the energy, it did start out, and you said yours was black. It did start out dark, but then the color kind of changed. Is that part of the process?
Yes. What I do when they download that thing, they want to try it on themselves. But I would practice trying it on family members. And the way that I do that as I'm walking you through it is you and I are having a conversation. I'll say, well, tell me what you see, Donnell. And I'll ask, does it change? And what you'll notice is not only do the colors change, the size of it will change. Mine started to shrink in here and eventually it just dissolves. Because people might ask, well, when is it done? a lot of times you're going to see it just starts to, and the breathing helps. You're breathing and you're just, when you hear, and the pop-ups are important. Like I could sense a little bit of sadness, overwhelm, different things like that. It's like your subconscious is giving you a message. And when it's kind of exhausted of everything it wants to tell you, it just kind of lets go. But yeah, it does start to change, and then eventually it should just disappear.
Right. And I did. I felt it was the size of a grapefruit, and then it went down to like a racquetball size. So that was very interesting. And we still haven't had any chats or comments come in. So I would like to say that biotone.com, under the EDU-TALK tab, does have four of Kerry's talks since 2020 when we began these. One of the talks is with James Wislowski, which was local versus specific
Systemic, no,
treatment option.
systemic versus specific. So
Okay.
I did the systemic approach, okay? And so, for example, if we go back to that picture here, is that I would have, when I would have taught them how to treat the total body lesion, the transverse diaphragms, the lines of fascial tension, autonomic nervous system, but then James would have focused on the knee. What do we need to do to the knee? Yeah, that was a good one. We had fun back and forth on that one.
That was good. That was so informative. So do visit biotone.com under the EDU-TALK library. Emily was asking this, or commenting, this reminds me a bit of somato-respiratory integration.
I don't know that one. I know somato is body. Now, when we do, that's just a self-treatment. When we do the energetic balancing, we are going to be actually working on holograms on each other. And so, I can work on, let's say, your neck. I can work on a bone or a muscle or fascia or an organ. And so you work on that between, your hands. So at the beginning, we start with an area of tension because that's easy for everybody. And then we progress to a location to work on, like just a shoulder or an elbow or a knee. Then as the class progresses, we get very specific. We work on a specific muscle, a specific bone or part of the bone, a specific suture or joint, or a specific, organ or blood vessel or whatever. So it gets very specific, and we have many different techniques that we work with. What we were showing today was something called hold space, where we just kind of hold our hands here. We don't move them at all, but things are changing. But we have other techniques where we actually will mold things or realign it or listening and following, or we do a fascial glide. So it's not, what I showed you today is just very basic, and it's just kind of dipping your toe in the water. So it gets much more complex with sort of what we do with our patients, and also it can get more complex with yourself. You don't just have to treat an area of tension. You can get very specific and treat your gallbladder or treat your 12th vertebrae or your 12th rib on the right side. You can do anything very specifically. It doesn't have to be just an area of tension.
Emily had replied about the somato-respiratory.
Okay.
It has a lot to do with moving energy through the body using the breath. The connection to breath was what made me think of it.
I see. Okay. Yeah, the breathing, I just kind of added that and I have it on that sheet. But it's not something that we do with the technique. We don't focus on the breath so much. We focus more on observing the hologram. When we observe these energetic holograms, our focus is training ourselves to use the five senses, but also come from a place of attention instead of intention. Is that we come from a place where we're not trying to fix or change anything. We're just trying to create a space for change where we just observe for change. And what's amazing is as you start to do this more and more, your focus starts to change, and you can actually see what it is you're working on, but more, you can also feel it. And as it begins to change, just like we did here, you can feel it disappear, and you can feel the quality begin to change as well.
Very good. And it sounds like it's guided all the way through the treatment. You're guiding
Oh yeah. Well, you're taking them through it and it's very quick. I mean, when I do an energy balancing treatment, it's under a minute. It's very
Oh,
quick.
okay.
You can treat the whole body in probably 10 minutes. So it's very, very quick. And what we do is evaluations before and after, because energy medicine is so subtle. In order to see the changes, you want to see changes in, let's say, posture or range of motion. And if we do a live class, I taught this at the FSMTA. We did an energy balancing there as well. And it was amazing as you could actually feel the physical changes in people's bodies as well. But if they go on the YouTube channel, there's lots of demos of me using energy balancing and students there and measuring the before and after.
Okay, and your YouTube channel will be included in the follow-up email tomorrow as well.
Yep, it's right there.
Oh, great. Thank you for putting that up again. And what I'd like to do is mention our upcoming EduTalks. And for those of you who are not familiar, that we also do an EduTalk diabetes series. And many of you have clients or patients with the challenge, challenged by diabetes, or family and friends. This next week on September 17th, we have Linda Lockett-Brown presenting dietary supplements in diabetes, what works, what doesn't, and what's potentially harmful. And again, on biotone.com, under the EduTalk tab, you can find both the EduTalk upcoming RSVPs and archive library, but also the diabetes RSVP and archive library is there. And Linda Lockett-Brown has presented several very good talks. She's a dietitian, and I'd encourage you to take a look there and join us Tuesday night. On September 24th, Peter Coppola will be presenting Introduction to Visceral Manipulation. And then when we get into October, we have Kathleen Leeson, who has also presented EduTalks over the past couple of years, again, in the archive library. And she will be presenting Massaging Clients with a Breast Cancer History After Implant Reconstruction. And I think she's done 2 or 3 EduTalks for us as well. Excellent resources in the EduTalk library. Kerry will be with us next year again. And thank you, everyone. If you don't see the follow-up email tomorrow in your inbox, please check spam. And with that, be safe. Okay, one last question. How do we become open enough to feel sense all of these things, Kerry?
I mean, if I can do it, I'm an ex-football player. If I can do it, anybody can do it. We guide you through all this with very simple things. That's what the first day is all about, is just getting everybody to feel this stuff. And the more you do it, the more you practice it. And you can do basic things like right now, everybody close your eyes. And you can practice, like if you're sitting, for example, be aware of the pressure that you're sitting on. Or if you're standing, be aware of the pressure in your feet. Be aware of the temperature in the room. Okay. Be aware of any sounds. You hear my voice, maybe there's a dog barking in the distance, or music in the distance, or rain or wind. If you're having dinner or going to have dinner, be aware of the smells, be aware of the tastes. Be aware of your thoughts. You know, what comes in there. A lot of times we judge ourselves, we judge others, we judge situation. Start to pay attention to what it is your body is doing. A lot of times, 85% of our day, we're on automatic pilot. And the key thing is that we all have the ability, but we're just too busy doing things. Just sit and, just for, a minute at a time, and just learn to pay attention to your senses. And then they will develop more and more. And then you'll be able to feel things with your hands. But we teach you that in the classes. That's why we have the introductory class first. See if people are interested. And if they are, then they can go to the longer class.
All right. Thank you for that. Thank you, everyone, for attending. Please join us again. We've got a great lineup of EduTalks through the end of the year. Look for Kerry at AMTA if you're there. And be safe, everyone. And take care. Thank you again, Kerry.
Thanks, Donnell.
Much appreciated. All right, everyone. Bye-bye.